must be my cranial nerve exam appointment. Yep. Yep. Is this your first cranial nerve exam? Okay. Pretty much it's just a series of tests to make sure everything is working properly. I will be testing your sight, your taste, your ears. It's just a variety of tests, and it takes about a half hour to 45 minutes, somewhere in there. So, is that what you're here for? Okay, good. Well, I'm just going to start by asking you a few questions. First off, what's your name? Okay. And how old are you? And I know that you said that this is your first one, so I guess I don't need to ask you when your last one was. Alright. Any medications you are currently on, just as a precaution? Okay. No, that drug, that should not affect anything we're doing here. It's just, I'm required to ask a question like that. Okay. Do you have any sensitivity to high-pitched noises or low-pitched noises? No? Okay. And what about light? No sensitivity to high light? No? Okay. Alright. So, that's pretty much all we have to do for questions. That's all we really need to know for this test. So, the first thing we usually start with is smells. So, what I'm going to do is I'm going to take a piece of fabric that has been drenched in some kind of fragrance, and you just have to tell me which fragrance you think it is. So I'm going to be doing this 3 times with 3 different fragrances, and we'll see if we can get them all. Alright, so I'm going to hold this up to your nose, and just tell me what you smell. Yep, that's mint. Good job. Okay. That's a good start. Let me grab the next one. And now just tell me what you smell. Yep, cherry. Good job. And now, this is our most difficult one, but there should be no problem recognizing what it is. Alright, just one more time. Tell me what you smell. Yep. Now, can you tell me what kind of soap? No, I'm just kidding. You just have to tell me it was soap. Alright. So, your nose seems to be smelling everything the way it should be smelling stuff. So, we're going to move on to the next step. And the next step is, what do we want to do next? Let's do this. what I'm going to do here is show you a page full of words, and I just need you to tell me or read me the word that I am pointing at in this page. Okay? Alright. What does this word say? Good job. Alright. Can you tell me what this one says? Good. And what about this one? Very good. Alright, let's see if we can give you a hard one. What does that four-letter word say? What is that four-letter word? Good job. Alright, so you seem to have no problem reading, and your eyesight with reading seems very good. You obviously told me all the words correctly. So, next thing we're going to do is I'm going to put on a pair of gloves, and you're going to tell me which hand is moving. I'll show you what I mean in just a second. Just let me get these gloves on. So, in this step, what I need you to do is I'm going to have both my hands out in front of me. And when you see one of my hands moving, I would like you to tell me that you see my hand moving and point at which one it is. Okay? Good. Very good. There you go. Good. Yep, both is an answer. Yep. Good. Just a couple more. Yep. Very good. Good. Okay. So you had no problem with that test. Now I'm going to do a very similar thing, except this time you're going to tell me when my hand is moving, not which one, because I'm going to cover each eye, and with the other hand I'm going to move it, and you're going to tell me when it moves, okay? Alright, here we go. Good. open and close my hand in each sequence. Yep, once. Of course, 4 times. Alright, now I'm going to do the same thing with your other eye. Yep, 3 times. So, as far as I can tell, your eyes are working as well as they can, and you can count to 3 or 4. So, there's no problems there. Now, this is where I'm going to take a light. This light. And I'm going to shine it into your eyes. And you're not going to do anything. You're going to sit there and look at the light. And I'm going to make sure that your eyes are contracting properly or dilating properly. Okay, you ready? That one looks good. Yep, that one looks good. Let me just test one more time. Yep, everything looks good with that one. Okay, so both of your eyes dilated properly. Now, I'm going to shine the light in your eyes again, except this time, your goal is to follow the light with your eyes. Try to keep very smooth movements with your eyes. Try not to jitter them, if you know what I mean. Just nice, smooth movements. Please. We're going to make sure that your eyes are tracking properly. Okay, here I go. So, your eyes seem to be tracking properly. Now, for a third time, I'm going to shine the light in your eyes, but this time, I'm not trying to test dilation of your pupils. I'm going to be looking deeper into your eyes, so I'm going to have to get up very close, if that's okay with you. Okay. I'm just going to look for any abnormal behavior in the eye when a light hits it. Okay. Oh yes, everything looks very good right now. Yep, there's nothing abnormal about your eyes. Everything looks very good. Alright, yep, this one, besides a little bit of a bloodshot eye, there's nothing of concern in this eye. So, with that said, your eyes are fine. Your nose is working properly, your eyes are working properly. Now we're going to move on to your ears. Now, you did tell me that you don't have any sensitivity to hearing loud or low frequencies. What about high frequencies? Okay, so there's nothing to be worried about there then. First thing I'm going to do is I'm going to clean your ears a little bit. Sometimes wax inhibits the ability to get a good result of a test like this, so I'm just going to do a little cleaning inside your ear just to make sure they're in tip-top form, ready to do this test. Okay, just sit very still. I don't want to poke anything in your ear that I shouldn't be poking. It might tickle a little bit. Okay, now the other ear. Your eardrums are free of any obstruction, and I will commence the next part of the test. So, in this part, I'm going to be squeezing my hands again, except this time you're not looking at my hands, you're listening for my hands. I want you to tell me if you hear the noise in your left ear, your right ear, or both ears. Okay? Here we go. Good. Very good. Yep. Okay. Yep, one more. Okay. So far you're acing this test, as you should. If everything's working properly, there's no reason you shouldn't get everything right on this test. Now, I'm going to move my hands in a direction, and I just need you to tell me which direction my hand moves and when you can no longer see my hand. Okay. So when you can no longer see my hand, tell me to stop, and then I'll ask you what direction the hand moved. Okay, what direction was it going? Yep, okay. And the direction? Yep. And what way was it going? Yep. And one more. And what way one more time? Good job. Now, I'm we have these little tablets here. These are very new. These tablets are full of a flavor, and this flavor is going to be very strong, and it's either going to be sour or bitter. Now, although bitter might be nasty, we have to do this test to make sure all your taste buds are functioning properly, and make sure that your brain is registering taste the right way. So, here's the first tablet. Okay, open wide. Okay. Now, was it bitter or sour? Sour? Okay. Like a lemon? Yes, of course. And we only have one more tablet. You might dodge a bullet and not get bitter this time. Open wide. And what was that one? Sour too? Alright, good job. So, you dodged a bullet, you didn't get bitter. Normally the patients that get the bitter ones are not too thrilled. And we only have one more part of the test. And this is also a test where I have to get very close to you. Is that okay again? I'm going to be whispering a series of 3 numbers into your ears. You need to repeat back the numbers that I say to you. Okay. 28, 7. Yep. 28, 9, 900. Okay, good. 6, 6, 17. Yeah, very good. If the traffic is too noisy for you, I apologize, and we'll redo the test if you feel that the traffic has flawed the results. I'm very, truly sorry about that. Okay, one more time. 4, 55, 762. Alright, very good. So, that was the last portion of the test, and you did as well as possible, and that's very good considering the noise levels around today. It's a very busy day. So for your follow-up, I'll go over your results now. Okay, so the first quarter, you got 100. Second, 100. Third, 100. And fourth, 100. You can't get much better than that, so I don't really have to say many things to you besides whatever you're doing, keep doing it. You seem very healthy. Your eyes, ears, mouth, your nose too. It all seems as healthy as it can be, and I don't have to prescribe you anything or give you any suggestions. I'll just tell you, just keep up whatever you're doing because it seems to be working very well. Okay, so if you don't have any further questions, that will bring an end to this exam. No questions? Alright, thank you very much for stopping in today, and I'll see you back here in exactly 1 year. I'll have the secretary write it up for you on on your way out. Alright, thank you.